All right, it is 16 minutes gone past 5, and you're tuned into the smoothest dial on radio, Smooth 98.1. All right, it's time for us to talk about our health on Smooth Health. And today is definitely going to be an interesting session. So if you need to go tell anyone, well, do that quickly. Go tell your friend to tell a friend to tell a friend to come through, as we're going to be discussing something very important today on Smooth Health. And yes, what are we going to be talking about? We're going to be understanding sexually transmitted diseases. We're going to be, debunking some myths as well as putting out some things clearly in plain terms for you to know. And my guest this evening is none other than Dr. Abiola Ajayi, the MD and CEO of ROA Specialist Hospital. Good evening, Dr. Ajayi, and good to have you.
Good evening, Joy. Thanks for having me.
Great, great, great. So Lagos, come through with your questions. Yes, I'm sure you would have a ton of questions, especially with this interesting conversation that we're going to be having this evening. And hey, all those myths you've also been having that you probably weren't sure about, well, we will be debunking them as well this evening. So come through and ask all the interesting questions you want to ask, and I'm sure that Dr. Ajayi will be there, will be available to address them as we go. So talking about STDs, I know that in clear terms, these are sexually transmitted diseases, right? Um, as much as I know that you will be giving us a breakdown of what they are, how often should one actually get tested for them? But let's start out with you explaining in clear terms what sexually transmitted diseases are.
Sure. Again, thanks for having me. This is an extremely important topic for worldwide, but especially for Nigeria. I'll give you some statistics about STDs. STDs, or sexually transmitted diseases. That's what we call them in the States. In Nigeria, Europe, they call it STIs, which are sexually transmitted infections. Both the same
Okay.
thing. They're just infections that are passed from one person to another through sexual
Mm,
contact.
mm.
So that means, vaginal, anal, and or oral sex, all include. So any infection passed through these contact with this through this, what we call sexually transmitted infections. Some of the common ones are chlamydia, or they used to call it the clap. I'm sorry, chlamydia, gonorrhea, which was called the clap, syphilis,
Okay.
HIV, another one called HPV or human papillomavirus,
Right.
um, hepatitis B,
Mm,
and chancroid is another one that we see. But the ones I see every day in the clinic here:
mm,
HIV, hepatitis, HPV, which causes genital warts,
mhm.
syphilis, gonorrhea, and chlamydia. We see those often. When we're talking
Okay.
about HIV,
Right.
it's estimated that almost 2% of adults 15 to 49 years in Nigeria, which let's say is about 2 million people in Nigeria living with HIV as of 2022. And
Okay.
when you compare that to the U.S., it's only 1.2 million. Now Nigeria has far less people. U.S. has over 300 million. Nigeria has just over 200 million. Yet, even with a lower population, our HIV burden is higher. It's a critical public health issue. So, and that's just not HIV. That's other STDs. So this is an excellent
Right.
topic to talk about. When you're talking about testing
Mm-hmm.
in the U.S. or even awareness, which is why I love doing these programs with you guys, because it increases awareness for everybody. Only
Right.
67% of people in Nigeria even know that they have HIV.
Oh my
And
word.
for in the US, that's 85% of people know they have it. So, meaning that 33% or a third of people with HIV in Nigeria have no idea that they have it. So, of course, they're not getting treatment and they're not protecting themselves or others, which is extremely worrisome. When you look at the youth in Nigeria, ages 15 to 24,
Mm,
that accounts for 50% of all new sexually transmitted infections. All the new infections every year come from that population. 50% of them come from that population, even though they only represent 25% of the sexually active population. So yes,
Right.
this is important for people of all ages, but especially, the young ones listening need to really take note. So you
Mm.
asked, the second part of your question was asking about
Oh,
frequency of testing.
right.
Yeah.
Especially,
And
see, like you just mentioned, like, okay, so we
mhm.
have younger ones who are experimenting, or you have people who are just getting into relationships and the like. So, you know, it is actually a good one to know. Am I supposed to be testing with each partner that I'm getting with, or is there a certain time that I'm supposed to be testing?
That's an excellent question. I like to do textbook statistics and then what I actually practice.
Right.
In the textbook, it tells us in sexually active people, especially those that have multiple partners, should get tested annually, right? That's every
Mm.
year. And we'll add some practical nature in there because you mentioned something that was important. Every time you get a new partner, it's
Mm-hmm.
important to get tested. Important to get tested for you and the partner. And I'll just remind people out there, you just because somebody says they're clean or says they were tested or said it doesn't matter. Just
Right.
because you looked at the genitals and you think the person looks quote unquote clean, that means absolutely
Mm.
nothing. Absolutely nothing. That even if you're
Oh.
clean looking or you don't have symptoms, what we call asymptomatic, or meaning no symptoms, you can still have the disease and you can still transmit the disease. And that's any of them.
Oh,
That's any of
wow.
them. Genital warts, HIV,
Mm.
syphilis, chlamydia, all of them can be transmitted by people that are not showing signs of the disease. So it's a very important. New partner, get tested. You're sexually active, get tested every year. If
Right.
you if you do risky behavior, multiple partners, what
Okay.
is well extra risky, right? Multiple partners,
Right.
what they call high risk group. These are
Right.
people that either are in sex work,
Mm-hmm.
or like porn actors in the U.S. Porn stars get tested every 2 weeks,
Okay.
and they have to show, that's 25 times a year. They have to
Mm.
show the proof of testing before they can get on any movie set. And since they
Okay.
went to that, they have only one documented case of HIV transmitted in the last 10 years, which
Mm.
before it was a lot higher. My recommendation for people here is every 3 to 6 months, if you're in the high risk, meaning you have multiple new or multiple partners, men who have sex with men,
Mm-hmm.
or those that have a partner who has an STD. For example, I have some people that are married. One person has hepatitis B, the other person doesn't have hepatitis B. And if you've not been treated and tested
Hey.
and done the right thing, yes,
Mm.
then those kind of people should be tested every 3 to 6 months, just to make sure that they have not transmitted. So, good question and extremely important.
Thank you so much for, giving us that statistics because that's actually worrying. If you just think, oh, okay, so walk in the park, I'm good. As they say, it doesn't show on the face, doesn't show body wise because people will assume that, oh, okay, you look healthy, so you're good to go. But thank you for, pointing that out. Okay,
One
so
little thing I'll add very quickly:
go ahead, please.
diseases have something called an incubation period. So if
Right.
person A that has no disease
Hmm.
has sex with person B that has a sexually transmitted disease, and
Hmm.
person A goes and gets tested 3 days later, and
Hmm.
it's negative, that does not mean that you're covered. That the sex that you had 3 days ago was okay. You have to test yourself again because it may take, if it's, for example, HIV, the test may not be positive for a month.
Oh my.
For some other ones, some of the, especially the
Hmm.
bacterial ones, they may not be
Right.
positive for 2 weeks. So imagine now if you have multiple partners or you're engaging in risky behavior, you now
Hmm.
have sex with somebody that has an STD. You get tested in a week, you think you're fine, and you now continue that
Hmm.
behavior with other people. You can easily be passing along a newly acquired STD. So just because you have a negative test on a Monday and you have sex on Tuesday doesn't mean that it's going to still be negative on Wednesday. And you have to you have to retest yourself because it takes time before these tests become positive in the body
Mm,
or in the urine or in the bloodstream.
mm. Well, that's actually, very important information there. So, it is not something to just overlook and just say, "Oh, okay, I've done my testing today, so that means I'm good." Just make sure that you are consistent and making sure that you're also not doing things that you shouldn't be doing. Okay, so more or less, I know some STDs have signs and symptoms to look out for. I know that some you mentioned genital warts in some situations, but how can one even figure out if they have an STD? I've heard that sometimes it's probably when you're itching, or probably when you've gone to the urinals and your pee is having some effect on you.
Right. Burning.
So,
That's what we call it,
burning, all
burning
that
or
burning
yeah.
sensation. Well, I'd like you to also help us understand the signs that we need to look out for when one thinks or should assume that they have an SCE. However, bearing in mind that I know that, yes, once you think you have something, go to the hospital and see your doctor immediately.
The early signs of STDs, they can vary based on the STD, but some of the ones that I see often are unusual discharge, whether that's a vaginal discharge or a penile discharge. What you mentioned, pain with urination or burning with urination.
Right.
I see sores, like wounds or bumps on the genital, and itching
Right.
is also part of it. Some other ones can include pelvic pain, bleeding, and of course fever because it's an infection. But
Oh,
it's
okay.
very, I'm going to repeat it again. It's very important to know that a lot of STDs are asymptomatic, or meaning no symptoms.
No signs.
So no symptoms. So you cannot rely on these. But if you were to have an unusual discharge, pain during
Mm-hmm.
urination, pain during
Right.
sex, bumps, genitals on your genitals, or itching, of course you need
Mm-hmm.
to come and see your doctor as soon as possible. But you may not see any visible signs, and the,
Mm.
the disease can still cause very serious health issues. So it just reminds us that it's important to get regular testing if you're going to engage in sexual activity.
Very scary when you put it that way. But if you
Yeah.
love your health, you should also be doing the things that are right. So you're not. Mm.
Women. Sorry to interrupt you, Joy.
Go ahead.
Women in Nigeria and in other countries, but I'll give you Nigeria statistics. They're twice as likely to contract an STD than men.
Mm.
And it's important to know that because I see the patients, almost every day.
Okay.
Some women are doing it. They're looking at the man's penis. Is he clean? Did he tell me that he's fine? Did he tell me, and believe in it? And the reason why they get it twice as likely as men is due to anatomy. Women have a very short urethra. That's the tube that empties the bladder for urine. Men have a very
Right.
long urethra. So it's harder for men to get infected, some of these infections. And then women have openings that can get affected during sex more than men, especially during heterosexual sex. So it's just important to know that women are twice as likely to be affected, and some of them,
Mm-hmm.
like HPV, that's called human
Mm-hmm.
papillomavirus, it causes genital warts. Some of them, um, some of them can cause like HPV can cause cervical cancer, right?
Oh,
So
okay.
cervical cancer, can be caused by untreated HPV. HPV is the
Mm.
number one most commonly sexually transmitted disease. And
Mm-hmm.
cervical cancer is the second most common cancer in Nigerian women. And 23 out of 100,000 die from it. And 33 out of 100,000 have it. And so these statistics are important to know that these are not small pockets of people. This affects it
Everyone.
can affect everyone. Exactly.
Mm. Okay. Well, I have a question here from Ali, and Ali says, it says that there are people who say that they are on PEP or PrEP, and they stand by the
Mhm.
notion that they can indulge with an uninfected person and won't infect them. How true is this? Also, he says, Are there long-term side effects of people who are using this medication on their organs?
That's an excellent question. So, what people, let's define it for the listeners: PEP or post-exposure prophylaxis, and PrEP or pre-exposure prophylaxis. So, prophylaxis means you're treating a disease
Okay.
before you have diagnosed the disease or before the person is positive. For example, like this person's example, somebody may be on what they call antiretroviral therapy or HIV medication, and they
Oh,
don't have
okay.
HIV, right?
Right.
And they don't
Yeah.
have HIV, and they now think that, oh, because I'm on the HIV medication as
Hmm.
pre-exposure prophylaxis, I'm safe to have
Right.
sex with anybody, whether they have HIV or not, because I
Or
can't
not.
get it. Right?
Okay.
Post-exposure is I may be infected with the disease, but I since I'm on the medication, I can't infect anybody else. And that is just absolutely false. That's not how it works. All these drugs reduce your chance of gaining the infection or passing the infection along. Yes, some of them can even reduce it significantly, but it's
Right.
not 100%. So there is still that chance that you can infect the
Pick
other
it up.
person. Yes,
Mm.
or that you can be infected. So when you know some of these, most important thing to know, I think we'll talk about cures and treatments and stuff, but a lot of these diseases do not have cures. They only have management. And a lot of them can shorten your lifespan significantly. So it's like you're taking this drug thinking it's 100% and you're just playing roulette with your life. You're just playing with your life.
Oh.
At any time, one of these sexual interactions can still give you the disease, still shorten your life and put you in an early grave. So I would
Mm.
not want to risk my own life on those kind of numbers. But that's a very good question.
All right. Well, I'm sure that Ali has gotten his answer so far, and yeah, we'll be better informed. Okay, so now
Another
let's
another
go.
thing,
You
just to
want?
buttress on Ali's point, another thing I see a lot
All
is
right.
people will have, risky sex or sex with somebody they don't know and this and that, then run to the pharmacy and take a couple tablets to just wash the system. That does not work. That does not. You can't just take some tablets for a day and
All
think that,
right,
oh,
and
the
it's
sex you had yesterday is. Yeah, it sounds funny to you. It sounds funny to me, but
but it
I
is.
see it all the time.
Oh my word. Hmm. Okay, interesting. Well, that's why I have the doctor with me to, debunk all this myth that people usually have and put things straight. And talking about misconceptions, right? Let's even get into misconceptions about STDs and transmission. You've already touched on it a bit. So, what other misconceptions are there regarding STDs that one needs to know? I definitely want them clarified, especially when it comes to herpes, or like you've just debunked that um uh of HIV, and you being on
Mhm.
medication and thinking that, oh, once I take a medication, I'm good. I've also heard where some individuals would take maybe they've just engaged in some sexual activities, and then the next thing they're taking some antibiotics, which are so eh, well, antibiotic reactions to body and things. Well, that's on another that's another conversation we'll be having sometime in the future. But now let's even talk about those ones that you just see them run to the pharmacy and say, oh, I want so and so and so and so, and I'm taking it to prevent or protect myself. So are these things that people should be doing, or are these habits safe? Because the whole idea behind it is once I take this medication, I am protecting myself and I'm in good standing.
Very good. I'm going to take it kind of in reverse order because I remembered Ali asked the second part, which is what are the side effects on the organs? And
Right.
one of the myths is that, oh, I can run and take this, usually it's an antibiotic. I run, take this antibiotic. I know the name of it. I'm intentionally not
I'm
saying it,
intentionally not mentioning any eyes either.
but they'll go and take this antibiotic
Right.
and clear the system. Number one,
Right.
antibiotics don't work that way. Not most of them don't work in single doses. There's a few, but it's not for most STDs. Number two, a lot of the infections we're talking about are viral. So antibiotics have no effect on viruses. Those would be antiviral medications. Now, either one of them, antibiotics or antivirals, all have side effects. Everything has side effects. Some of them are as simple as stomach upset and running and diarrhea. Some of them can cause erectile dysfunction. Some can cause
Right.
liver damage. Some can cause kidney damage. All of these
Mhm.
things are serious side effects. So you wouldn't want to be taking these medications if you didn't have to. And you definitely don't want to hide behind them thinking that there's no risk to taking them. There can be a lot of risks.
Mhm.
Another major misconception is that STDs can only be transmitted through penetration, right? And that is just absolutely false. You can be transmitted through oral sex, anal sex, and even close skin to skin contact. Especially when we're talking, remember I said HPV, the virus that
Yes.
causes genital warts?
Hmm.
It can be transmitted by skin on skin contact.
Right.
So, and it has no cure. And it is the most commonly transmitted sexual disease worldwide. So just rubbing genitals without penetration can give you a disease that has no cure, right? And we also mentioned that HPV caused cervical cancer in women, second leading cancer in Nigerian women. So these are all risky behaviors that you really don't want to do if you value your life in any way.
Right. Stay away
Another
from risky behaviors.
yes, please do. Another very common myth is that condoms offer 100% protection, which
No,
is
wait. Are
is
you?
not true.
Oh my word! Now
Mhm.
you're breaking a lot of people's hearts because
Yep,
they already assume that, or they've always had this notion that once you have a condom on and that's it, you're protected. So whatever else happens is by the way. But now you're
right.
saying it's not a feel safe kind of situation. Please enlighten
Absolutely
us.
not. Yeah, well, I'm not saying people should not use condoms. Condoms are very good. They reduce the risk significantly, but
Right.
they cannot eliminate it entirely. Especially now, we just talked about HPV. Also, that's human papillomavirus. Also, herpes virus. Both of them can be transmitted through skin to skin contact.
Right.
So condoms shift, condoms move, and condoms don't cover your entire skin.
Mm-hmm.
So at times you can have skin to skin contact, and things like HPV or herpes. Remember, they don't have any cure. Neither, but both of them don't. You can
Right.
still be transmitted. I even want to add an anecdote. I know a young lady, Muslim, did not have sex until she was about 30 years old. Had sex once
Oh.
and developed genital warts.
Huh?
A few months after. Yes, I had to laser them off in my theater once. And this is somebody that I known, trust, know for a long time, but had
Right.
sex one time, now has genital warts for her life, the rest of the life. There's no cure. So yeah, I can burn them, I can laser them off in the office. You may not see them. You have to put them on
Right.
medication. You can manage the disease, but there's no cure for it. And I just feel so badly for her because she was lied to by the
Partner.
young man in question, by the partner. So
Mm.
if we can save even just one person from that, that's extremely important. That's another myth that you can't get an STD if both partners are clean. They look clean. Like we said,
Mm.
being asymptomatic or having no symptoms is common in a lot of these infections. You know,
Right.
the one I hear 1,000 times is that you can catch an STD from toilet seats,
I was
right? And
waiting for you to speak on that one because the myth around that, mm, just from the toilet seat,
th-
how? But hey,
that
like I
myth
have you to
has
share.
that myth has caused a lot of breakups. I can imagine, whether it's boyfriend, girlfriend, or husband, wife, because I've had people in my office with a discharge we have to treat. And I'm asking, have you engaged in this behavior? No, doc. I used the toilet at this
So
restaurant,
and
and I'm
so.
very sure
Mm.
that's where I got HIV from. No, I'm very sure that's not where you got HIV from. I'm very sure that is more than likely the unprotected sex you had, or you could even get it from blood transfusions or something like that. But very rare, it's not a fact that through contact with toilet seats, you'll now get an STD. That's just not how it works. Bacteria and
Mm-hmm.
viruses, that the most common ones, don't really survive that long outside of the body.
Mm-hmm.
And life on a toilet seat is not the best life for a bacteria or a virus. So it's very, very unlikely to happen.
Okay.
I have a couple more if you want a couple more.
Uh, as much as I'm guessing that would probably have a part two of this, but I want to actually touch on something that
Okay, good.
you spoke about earlier on and has to do with reproductive health. How does STDs impact reproductive health, especially for those who does it affect the fertility of this person, or could it have negative outcome for someone who's pregnant, or could it affect them in general?
I like to say that I've become an infertility, let me say erudite. I don't know if I'd say expert. I don't like to talk about myself, but I've become an infertility because I see so much of it in practice here that I'm forced to treat it. I've now enjoyed, making change in patients. And what's unfortunate that very few people understand that STDs can have a significant impact on reproductive health. So
Right.
let's start with women. Untreated STDs or poorly treated STDs can cause scarring in the fallopian tubes. Those are the tubes that carry eggs from the ovary into the womb. And
Right.
you only have two, one on either side of your body. And if you have an untreated STD, number one is chlamydia, number two is gonorrhea in this country, can cause those fallopian tubes to be blocked. That person is now infertile. I mean, there's almost no way you can get pregnant if you have blocked tubes, or it
Right.
increases your chance of getting a pregnancy in the wrong place, what they call a tubal pregnancy or ectopic pregnancy,
Atopic.
which is a
Yeah.
surgical emergency. You've heard of those before, right?
Right. Yes.
So not only can the STD cause you to be infertile, can also cause you to run the risk of having an ectopic pregnancy, which requires a life-saving surgery. Half of the people that do ectopics in this country die. So
Mm.
also pregnant women that have STDs have
Mhm.
the risk of passing the infection to their babies, which
Sadly.
can sadly, which can infect the child, can also cause
Mm.
preterm labor, can cause low birth weight, can even cause stillbirth, And there's some infections that affect both the mother and child severely in this country. Syphilis, herpes, and HIV both have significant effects, serious effects on the mother and the baby. So if you're asking, do STDs impact reproductive health, fertility, even pregnancy outcomes, the answer is yes, a
Yes.
thousand times yes. And it's painful when you see a man and a woman newly married try to have
Right.
children for 2 years. You now see the tubes are blocked, and you try. There's nothing you do to open it. So now having a child has become extremely expensive because now you have to do IVF. IVF oftentimes is only 30 to 40% effective the first time. IVF in this country is
Right.
easily 2 million naira or more.
Hmm.
So, and you may not have to do 1, 2, 3 cycles. So you're talking about 2 to 6 million naira before you have one child, which is out of the reach of so many people. So this is something that's a good question too. Something to put some emphasis on.
Well, as much as it hurts me to actually say this, but well, at a time. But you know what? I'm hoping that we can have a second part of this conversation because there's so many things that we haven't touched and we need to, have conversations about. So I'm hoping that next week we can have a part two of this.
If you invite me, I will definitely be there.
Oh, thank you so much. And I'm sure Lagos would be itching to get in here and have all their questions ready as well. I actually see
Hopefully
some
not
people's.
itching. You mentioned that. Hopefully not itching, but they can be eager, and I'll be
Yes,
eager
please be
too.
eager, but not teaching, please.
Yeah.
Well, thank you so much, Dr. Jay, for giving us all this insight so far today. Yes, we'll go again next week, and we'll have a part two because there are certain questions that have not been touched, and we will get to know more when it comes to STDs talking about management, since there are some that are not curable at all. So we'll be
Mhm.
touching on that when we go next week. But thank you so much for sharing your time today and sharing all those insights. I trust you have yourself a pleasant evening.
Yeah, I'll also put some resources on our social medias, ROA Specialist Hospital, on
Okay.
all the ones that matter, Facebook, Instagram, Twitter, and people can engage me there until I see you next week.
Okay. Thank you so much for your time. And Lagos, thank you so much for coming through as well. And I'm sure you've learned a thing or two about STD. So we'll have a part two of this conversation next week. So don't go nowhere. Stay tuned to Smooth 98.1, where we definitely